Hello, my name is Hannah Hopwood, and today I'll be presenting on absolutism as an ethical concept within the healthcare setting. Ethics are an integral part of nursing. Absolutism is one ethical concept that works to offer transparency and clarity in adverse situations and ethical dilemmas. Absolutism demonstrates and asserts that the moral ruling is completely valid. Throughout this presentation, I'll define what absolutism is, explore the applications of absolutism in both society and healthcare, connect absolutism to professional standards within nursing, examine the case of ethical disagreements, and discuss implications within nursing care with patients. Before I can go any further into this assignment, it is integral to understand what absolutism actually is. According to Nelson in 2022, absolutism can be defined as actions being so morally wrong they should never be unconditionally done. Absolutism also believes that moral rulings are universal and unchanging, be applied in all contexts, and that there is only ever one right answer. Furthermore, Nelson argues within healthcare, absolutism and ethics are fundamental to safe and professional nursing practice. Whilst ethics may be a new concept for some, evidence suggests that moral absolutism has been present in society with origins to Greek philosophy, which have been carried through to Kantian absolutism and deontology, things or actions being right or wrong. Within a societal context, absolutism is recognized via universal laws and human rights. The Universal Declaration of Human Rights was developed in 1948 following the immense catastrophes of World War II and emphasizes on human rights. Adopted by the United Nations in 1989, the Convention on the Right of the Child recognizes that children are a very vulnerable population in society and therefore require further protection of care. The Convention on the Human Rights of the Child also acknowledges that children have the same fundamental human rights, whilst also recognizing that children have unique needs regarding their safety, development, and societal participation. This can relate to absolutism via the role of ethical stance forming universal and non-negotiable duty to protect children from harm. Additionally, safeguarding children's rights of freedom from violence, exploitation, and neglect possesses a moral obligation applying in all contexts, despite or regardless of cultural practice or situational pressures. Within the context of healthcare, absolutism presents itself through the Nursing and Midwifery Board of Australia. The NMBA works to define the code of conduct, standards for practice, and codes of ethics to protect the public via the regulation of nursing standards. As per the NMBA, registered nurses must act in a lawful way. Nurses must maintain a professional nurse-to-patient relationship, acting in a way of non-maleficence to do no harm and veracity. Nurses must do no harm to patients while also ensuring they always tell the truth and do not deceive a patient. Furthermore, in the context of absolutism and legal frameworks, it is absolutely not okay in any regard to act in a racist manner. As per Nursing Standard 2, specifically 2.2, nurses are required to be respectful of patients' cultures, values, beliefs, and rights and should never disregard this. In contrast, absolutism can also be reflected through nurses' right to conscious objection. If a nurse believes something in healthcare is considered inherently wrong, their right to refuse participation in a treatment demonstrates the promotions of nurses' autonomy and self-determination and promotes their human dignity. Although the nurse can have a moral conscious objection, nurses must also respect the common good of patients, promote non-maleficence, and simultaneously maintain a patient's confidential privacy. Veracity must importantly also be upheld, ensuring that the nurse is transparent and honest to the patient. Nonetheless, beneficence, the act of doing things for the benefit of others, is related, as despite the fact that a nurse may object, they must still act in a way to maintain their well-being and refer the patient to another healthcare professional to corroborate patient safety, quality of care, and respect for their wishes. As we dive deeper into the role of absolutism in nursing, we need to be reminded that absolutism is the standpoint that actions are inherently right or wrong, regardless of the situation or outcome. A prime example of this is a nurse's responsibility to mandatory report incidents of child abuse. As per the NMBA Code of Conduct and AFRA standards, nurses must practice deontology and absolutism hand in hand. Standard 1.2 of practicing in accordance to legislations, standards and codes of practice, and Standard 2.4 of ensuring documentation and mandatory reporting are constantly being met. Aligned with absolutism, the NMBA and AFRA explicitly outlined that nurses must comply with the laws and prevent harm, an inherently right action. Absolutism is upheld in the nursing professional codes and standards through the principles that must be upheld regardless of context. For example, the NMBA mandates that privacy and confidentiality must always be protected no matter the instance. Likewise, veracity and obtaining informed consent demonstrates the need to constantly respect autonomy whilst also acting with beneficence and non-maleficence. By doing this, it is ensured harm will not be met, even if it is deemed inconvenient. Despite the absolutist framework of deontology, nurses must actively navigate situations of high tension, forcing themselves to balance virtue ethics, ethics of care, and consequentialism when facing a dilemma such as resource allocation, which is very common in rural settings in Australia. Often, ethical disagreement arises when discussing absolutism and nursing practice in situation regarding Jehovah's Witness refusing blood transfusions. Absolutism, in regard to deontology, holds certain duties such as preserving human life at the forefront of responsibility and are always morally and ethically required. If a blood transfusion is the only way to preserve a patient's life, the nurse may want to act to administer the patient the blood in disregard to the patient's wishes. Conversely, as per the NMBA and APRA standards, respect for patients' autonomy, dignity, and the need for informed consent must always be upheld. For example, Standard 1.4 emphasizes that nurses must provide care aligned with the patient's choices in partnership, despite the fact that the patient's choice may cause them harm. When put into this ethical dilemma of the Jehovah's Witness not wanting a life-saving blood transfusion, a nurse must balance non-maleficence, common good, and beneficence in order to not violate the patient's autonomy. In conclusion, absolutism provides a clear ethical framework within the context of nursing by reinforcing universal duties such as veracity, respect for human dignity, and non-maleficence. The clarity provided by absolutism allows for safe and professional nursing care under all circumstances. Nonetheless, absolutism can also create tension when exploring the ideas of respecting patients' autonomy in the difficult case of a Jehovah's Witness refusal of blood transfusion. Absolutism is integral to the nursing profession and guides nurses to consistently practice in a safe way upheld into nursing standards and provide guidance within nursing dilemmas. Thanks for listening, and please see my references on the next two slides.